AI, detects early COPD from voice and cough sounds. Artificial intelligence is detecting early signs of chronic obstructive pulmonary disease, COPD, long before it's caught by traditional tests, by analyzing cough, breath, and voice patterns through a phone mic or wearable sensor. It's a powerful new tool for early diagnosis and lung preservation. Wageningen University, Netherlands, plus cough sound, AI. Researchers trained AI models to detect acoustic markers of COPD and chronic bronchitis with over 85% accuracy, even in early stages. Res App Health Plus smartphone-based lung screening. AI listens to cough recordings through a mobile app and diagnoses lung obstruction patterns associated with COPD, asthma, or pneumonia. Johns Hopkins Plus AI voice biomarker study. AI detects changes in voice pitch and breath control that signal reduced lung elasticity and airflow, often years before full-blown symptoms appear. This cough may sound normal, but AI hears signs of early lung disease. COPD is often diagnosed too late, after the lungs are damaged. But AI can detect it years earlier, just by listening. ResApp's app listens to coughs using your phone mic. It catches airway obstruction patterns with 85% plus accuracy. Wageningen's AI even spots chronic bronchitis from cough tone. Johns Hopkins trained AI to read lung function from voice alone. That means earlier diagnosis, better outcomes, longer life. It works on your phone, in minutes, no clinic visit. Doctors still confirm it, but AI gives them a head start. Early treatment slows damage and protects your lungs. Would you take a 30-second AI cough test? Follow for more ways AI is catching silent diseases early. Because breathing easier starts with detecting earlier. Please subscribe and share this channel. You may save a life. See you in the next video.